Good. Hi, my name is Dr. Espino. I'm the owner of Riverview Dental Arts and SMI Dental. This is the first time I've done a live session, so kind of bear with me. I've done a lot of videos over the last year and a half or a couple of years, and I actually kind of like this live chat or live session. I think it's I don't know, maybe get a better idea of who I am and how I talk to patients and my personality. It's really just generally strange talking to a camera. Yeah, welcome anybody that's live or is going to watch this. I just want to go over a lot of things, who I am, the practice, answering questions on crowns and veneers and ceramics and smile makeovers and all the things that I do here at my practice. And let me get started. So yeah, again, my name is Dr. Espino. I'm the owner of Riverview Dental Arts and SMI Dental. Riverview Dental Arts is my practice in Riverview, Florida, and SMI is a new practice that I have in St. Pete. I graduated from University of Pittsburgh School of Dental Medicine in 2011. In 2016, I bought an existing practice in Riverview, and that was Riverview Dental Arts. It was actually originally in a small house that was converted into a dental office in the late 80s. When I bought it as the third owner, we've grown it, and now I'm in a 5,000 square foot facility in Riverview around the corner from the original location of the business, with a full lab on site and 10 operatories. We have 5 full-time hygienists now and a couple dentists that work at that office. So it's gone really, really well just by practicing good dentistry, caring for patients, and doing that kind of work. It's just grown into a great practice. The St. Pete office, SMI Dental, I started in August of last year, and I'm going there 2 days a week. So I'm here in Riverview 2 days a week. I'm at the St. Pete office 2 days a week. And really at this point, as far as my clinical career and practicing a lot of cosmetic or rehab dentistry using ceramics when it comes to doing veneers or crowns or bridges, placing dental implants, things like that. So we call them, as dentists now, smile makeovers. A smile makeover is just a term basically saying if you don't like your smile, whether it's how it looks, if there's a lot of unhealthy issues going on with tooth decay, misalignments of teeth, missing teeth, it could be anything, that we're going to make over that smile, whether it's strictly for cosmetic purposes or we have some health-related problems with it when it comes to gum issues or tooth decay problems, those kinds of things. My love for dentistry has gone in a lot of different directions, but I've really fell in love with ceramics and doing cosmetic dentistry. In 2018, I got my first digital scanner. Some patients may have seen this, where we can take a wand basically and digitally scan your mouth into 3D and on a computer. And I feel like that's really changed my career, what I can do, because when we were able to go digital that way, not only could we digitally scan somebody's mouth where we didn't have to take putty impressions and make stone models, digitizing somebody's mouth into a computer means that I could use CAD/CAM software and actually design my own restorations and plan my own cases as a dentist. Before that kind of technology, it was done on a stone model using waxes on a bench top, and it would take an incredible amount of time to be able to accomplish any kind of design or thought, thinking through somebody's case. So the fact that digital has come so far is really put a dentist in the driver's seat on design and fabrication of their own restorations if they choose to go that far and go that direction. And most don't go as far as I've gone with it, to the point where I have my own ceramics lab, work directly with a ceramist who's a designer of restorations and a fabricator. I'm a designer of restorations. I have been since 2018, but needed to bring on somebody that actually knew a large amount about the fabrication and finishing of ceramics and that kind of part, because there's a design aspect and then there's a fabrication aspect. But so since 2018 till now, have really progressed in knowledge, ability, and so for the last year and a half, I've really focused my clinical career on doing ceramic smile makeovers, like again with crowns, bridges, veneers, implants. So we'll talk more about that. My office is still our general dentistry practices. We still do general dentistry. We still do fillings, and I've got cleanings and take care of general care. So, but what I do clinically now is really these rehab or smile makeover type cases. So that's kind of a background of who I am and how I started and where we're at today when it comes down to it. So today's main focus is really going to be on talking about veneers, crowns, bridges, ceramics, those kinds of things. What are the differences? And I'm going to go through kind of like a long series of frequently asked questions and go from there. So I would say probably my most common question that I get are veneers, crowns. What are the differences, pros and cons, all those kinds of things. So a veneer, a dental veneer, is where we're going to use either a ceramic or a composite resin material, and we're going to reface the front of somebody's tooth. And it's a very good technique, particularly for patients whose alignment of their teeth are good. They don't have a big grinding habit on their teeth. That all we're really trying to do is reface the front of the tooth for color, maybe close some small spaces in between their teeth, add a little bit of length, doing some minor changes to the patient's teeth, particularly with shade and some of the look. But with veneers, we can't change the position of the tooth significantly. It's not very effective for closing large gaps. If there's there's a big grinding habit, or if teeth are functioning where their patient has a very heavy bite in the front, veneers are not particularly effective because they can debond or pop off or break a lot easier than a crown does. So it really just depends on the patient. So veneers are great for, like I said, for changing color, changing slight changes of shape and those kinds of things. And the pro about it is that we only have to do any preparations and slight preparations just to the front of the tooth, and that's it. Versus a crown is a full ceramic cap that goes all the way around a tooth. We're able to change the shape, orientation, do big significant changes. The con behind it, I suppose, is how patients look at it, is that the reductions I have to do to your tooth is not just on the front. It goes in between, it goes all the way around, because a crown is a full cap that goes around your entire tooth. So how we do those kinds of things are always meant to save as much natural tooth structure. The big concern patients get when we talk about doing crowns are you going to turn my teeth into tiny little nubs? And if you look at a lot of pictures, or if you've seen, especially some older techniques that were done when doing crowns, we had to do a lot of reduction to teeth when we did crowns originally. A lot of the crowns originally were metal crowns with porcelain baked on the outside of them. So you had to have a large thickness of material, which means so you had to cut a lot of tooth away, not to have a giant looking tooth that didn't look right. Today's ceramics have come so far and are so strong that we don't have to do a ton of reduction, whether it's a veneer or whether it's a crown. So it really just depends on what the patient needs. If we have to do some large changes into closing gaps, rebuilding teeth, and we want to have really good retention because of somebody's bite, that's where a crown is going to be the best choice. A veneer is great if the bite accommodates for it. We're not doing a lot of big change on spacing or lengthening a tooth significantly, those kinds of things. And a veneer is a very nice conservative way to make over somebody's smile and give them the smile that they want. If somebody has significant decay problems, crowns again are really kind of the way to go, because we need to take out the decay, we need to fill the tooth and make the tooth healthy. But a crown's going to go all the way around the tooth and protect everything and hold everything together. Crowns are the way to go if we have significant decay problems. So, and not every not every case has to be all veneers or all crowns. It could be a mixture. And that's not uncommon that I look at if we're going to do 10 teeth, that maybe 6 of them are veneers and 4 of them are crowns. So it doesn't have to be all one or the other. I go over all of these parameters and what I suggest in the consultations. We're looking at all of these things, and I'm very open to discussing which one's better, and why. We could look at scans, pictures, and everything. And I want to make sure everybody understands why I would suggest one over the other. I'd say I probably more often do crowns than veneers, because most of the smile makeovers we have come, we need to do some significant changes, or a patient has decay problems, all kinds of things that, you know, that need to be fixed, and a crown is better. And everybody understands it once I show them and go over, and they're like, oh, okay, that makes total sense. And that's how that works. Kind of going through my questions here. What is the difference between porcelain and composite? So I get this. Yeah, I get this a lot. Porcelain and ceramic. People ask, well, is it porcelain or is it ceramic? That's the same. They're interchangeable words. Porcelain and ceramic are the same thing. It's basically, it's glass. And there's different kinds that we can use in dentistry. I use what's called high translucent multi-layer zirconia. And what that zirconia is, the name of the ceramic material I use. I've chosen zirconia because of its strength. Zirconia years ago was a very ugly material. We didn't use it to aesthetically restore front teeth because it was dull in appearance. It didn't have a lot of translucency. Translucency means that light it can shine through it. And if you actually take a flashlight behind your teeth, you're going to see light go through it. The older crowns that had metal in them, porcelain fused metal crowns, and a lot of these you can identify if you see a grayness around the gum line, you're seeing the metal show through. Light wouldn't show through that material, it would hit it and it would stop, and you have this really dull, opaque, chalky effect to it, and it was not aesthetically pleasing. So we were using another material called Emax for a long time. It's a glass material, ceramic, and that allows light to shine through it. The problem with Emax is that it's soft. It doesn't hold up to a lot of the strength for the long term. Zirconia now has come through with not only having the strength, but it's come through aesthetically that the stuff that the zirconia we use now is high translucent, allows a lot of light to shine through it, so it's aesthetically pleasing. And it's what's called multi-layer, where the material has a gradient built in it of a slightly variation of color that goes throughout the tooth. If you look at natural teeth are not monochromatic, which means they don't have one color that goes all the way through. If you look at the gum line, there's a slight darker appearance usually around the gum, because the enamel in that area is a little bit thinner, and then it will start to become a little bit lighter as you go towards the incisal or the biting edge of the tooth. So the material I use when we select shades, the base shade will be a certain shade that we have decided on between the patient and us. But it has a built-in lifelike effect with it. So the materials I use are very aesthetically pleasing, and they have the strength that we really, really want. So kind of going again, ceramic and porcelain are the same thing. We use high translucent multi-layer zirconia in my practice. And that's very different than what's called composite resin. Composite resin is tooth colored filling material. So if you're going to get a filling in today's standard, we don't place silver fillings, which is amalgam. We don't place those restorations a lot. And today's, because bonded composite resins have come a long way. So people ask, are you putting a tooth colored filling in? And most often, yes, we're putting tooth colored in. So what we're doing with veneering somebody's tooth, instead of using porcelain, we're going to use composite resin, which is filling material that matches to either the surrounding teeth, or we're going to brighten the patient's teeth up and use a lighter color. And that material is directly placed in the front of and bonded to the front of somebody's teeth. And we get a good aesthetic result with that also. That's not something that's fabricated at a lab like the ceramics are. I'll kind of go over that here. That's one of my questions. So it's a directly placed material, and we can get great aesthetic results with that also. So there are two different materials that we can use. We could either use porcelain / ceramic, or we can use Okay, yeah. Or we can use composite resin. We're talking about to go over. At this moment here, when it comes to the crowns and the veneering and everything that we're doing, I'm going to be changing the special a little bit. Right now, we're doing a $500 deal per tooth, and that's an all-inclusive thing. So if there was a cavity with it, or I had to take an old restoration off or anything like that, so $500 per either veneer or crown, whatever it is, and that's for a ceramic crown or a veneer, or if we're doing a bridge. If you're missing a tooth and we're going to basically bridge across it, it's still $500 a unit or a tooth. We're going to be doing a slight change in the middle of April. The cost is going to go up a little bit for the packages that I have for that. You'll be seeing that reflected here, and some of the marketing materials coming out soon. I will be offering also a composite version coming up, special. It's a little bit lower in price because it's not a lab-based milled thing, but it's a really great entry level for somebody who wants to do a smile makeover. I definitely encourage you guys now, if you're interested, to schedule a consultation for the ceramic versions, because in the middle of next month there will be a slight change with it. I will always be offering specials on doing smile makeovers with porcelains or composites. But it's going to fluctuate here and there. Let's see here. Are veneers reversible or crowns reversible? Technically, even a veneer, there's nothing really reversible about when we're doing a veneer or especially a crown. A common question people think when a veneer is done, that we're just going to take your tooth as it is and just put material on the front of it now without doing any what we call preparations or reductions to those teeth. And that the amount of preparation varies. When I say preparation, we're talking about reduction. The amount of reduction that we do to teeth depends on the outcome that we want. If a tooth is leaning outward and we want to recontour it back, I need to reduce more of the tooth in the front to bring it back where we want it. So if somebody has misalignment of teeth, one's out, one's in, one's twisted, we need to contour these teeth in a way to get them the shape that we want, and then we're going to put ceramic over it to achieve that result. It is very, very rare that, and I would say rare, that it almost never that there's no form of some kind of reduction to somebody's tooth, because I have to have a certain thickness of material that I'm going to put over somebody's teeth. So if we're going to just do veneers, for example, we're not doing crowns. I'm just going to put a material on the front of somebody's teeth. You don't want to have massive teeth, horse-like people would say, right? Or just too long, they're too big, they're too thick. I have to have some aspect of reduction, because if I have to put, let's say, a 0.5 millimeter of material or 1 millimeter of material over somebody's teeth, I need to have a certain amount of reduction so that when I put the extra layer of what I'm putting, that their teeth are not going to be too large or too thick. That's going to ruin the aesthetic value of the case. So the amount of reduction and how we go about it really just depends on the problems that we're trying to achieve. The whole point is to be minimal reduction when it comes down to it, whether it is a veneer or a crown, and it just will depend from case to case. So in essence, it's a permanent thing. Yeah, so there's no reversing. You're always a veneer, you're always a crown patient. The idea is to use good materials, get a good aesthetic result, and do it in a way that's going to be a long lasting. That's a very common thing. How long is this going to last? The idea is if you take care of these restorations, you don't get decay underneath of it. 20, 30 years, these are meant to last. This is not I have to do this every 5 or 10 years or something. It's if you take good care of your teeth, we keep them healthy. The idea is that these are going to last a long time. I think that's pretty much the majority of everything. I've gone over materials. What are the differences between crowns and veneers? Is it permanent? What do I have to do with, all these things? It's case to case and tooth to tooth. It just really just depends. What makes us very, very different? I think that a lot is other offices is that I've got my eyes on everything that we do. The ceramics are all designed here at my office. I work with Eddie, who is my ceramist. He's a certified lab technician. So we work directly together on every single case. So I know exactly what needs to happen. I convey that to Eddie. We design it together. We look at it together. And I plan the cases first. It's so important. If somebody comes in with misaligned teeth, or we want to lengthen teeth, we want to shorten teeth, we want to achieve a smile, we need to design the case first so that we know what we need to do to achieve that smile. So many dentists, and not everybody, there are some amazing dentists out there, but so many cases are done where you go into a dental office, they tell you that you're going to achieve a good aesthetic result. They don't plan anything. They just aimlessly grind on teeth and send your models of ground on teeth to an outside lab, and they say, make me a smile that makes sense. But that tech has no idea who you are. What did you start with? How long do we want your teeth to be? What are the shape? There's so many different aspects and details that are missed. And the case will suffer from it. So designing it is imperative is first. So I really want to thank you for joining and taking the time. I hope I answered a lot of questions, and maybe you guys have a better idea of who I am and how I am. I definitely would love for anybody to follow us. I do plan on doing more of these live sessions, answering more questions, doing more videos. I do answer a lot of questions direct myself on social media. If you're asking a question or doing comments or sending a message, that is me. I don't have somebody that's answering for me. I think that's about it. I'm looking forward to having consultations with anybody who's interested, or answering any other questions or comments that everybody has.
Growing up, I had a lot of orthodontic treatment in the past, and unfortunately, it damaged a few of my teeth. My name is Molly Moe, and I'm a patient at Riverview Dental Arts. Dr. Espino and his team were able to recreate all of my crowns, making them match my smile. They fit great, they have the great color, and they were also done the same day because of their in-house lab.
At Riverview Dental Arts, we perform digital scans and have a ceramics lab on site.
Normally I'm terrified about these sorts of things, but since I walked in the door to all the way back in the chair, everyone was so welcoming and comforting, and it wasn't painful at all.
Anesthesia-free, painless dentistry using the latest laser technology. Riverview Dental